Thank you very much, Dr. Ashwini. It's been a very invigorating morning. The diversity of opinions that have been expressed since the morning today, and I quite didn't know what to expect from some of the speakers whom I was hearing for the first time, but also the speakers I was hearing for I've heard before, still brought in certain nuances which I think for an old hand like me in Ayurveda is invigorating. I want to thank Professor Darshan Shankar and all the organizers, and also want to pray my namaste to all the esteemed Ayurveda Vaidyas who are present here. So in the time allotted to me, right, I want to quickly talk about Ayurveda services, right, and what does 2047 entail for us. When you talk about services, right, in this entire wide universe of Ayurveda, we tend to forget that how do we define service? And the fact that the nature of Ayurveda itself, whether I'm talking about Ahara, Vihara, Vichara, Aushadha, Kriya, is in the nature of a service. So why I want to bring this very basic slide which is known to everybody is to highlight the point that when I look at all of this, I have to consider Siddhanta versus Paddhati. Chikitsa Siddhanta, Chikitsa Paddhati. When I look at Ayurveda as a Chikitsa Sampradaya, I think what has happened over the last 100 years or so, we lost focus on the fact that Ayurveda was between Vaidya and the Athura, where it was a personalized interaction leading to a personalized solution, where I would consider all these factors, even and based, as I think as previous speakers spoke, based on the Rogi Roga Avastha, right? Where is the Rogi? What is the status of the Rogi? The status of the Roga, Rogabala, Rogibala, Desha Kala, all that I'm customizing. And if I'm going to do, I can treat. I'm sorry. So if you take with diet lifestyle, you can correct many diseases. Where the Bala is high, the Roga Bala is low, just with diet and lifestyle you're able to change. On the other hand, if it's a little bit more mature, Ahara, Vihara, Aushadha. And then for a chronic disease, for a very severely impacting disease with multi-system impact, as was mentioned, you need Ahara, Vihara, Aushadha, Kriya and Vichara. So we tend to compartmentalize and have turned this into a unidimensional perspective, telling I look at only diet, I only look at medicine, I look at treatment, whereas I need to look at Chikitsa. And I want to say all these are integral parts, whatever I am doing, whichever part of the business I am. The context in which we are placed today, right? India 2047, this is a stated vision of the government. India will be the third largest economy. Unemployment will be zero. It will be a developed nation. This is clearly the vision that the government of India has. It's a laudable vision, next 25 years. The reality today in Indian healthcare, out-of-pocket expenses is over 60%. That is a reality. Right? And 62%, the number is going back 20 years. So we don't know today's data. Maybe it is less, maybe it is more. The fact that there is a multi-generational health deficit happening today. Why I bring this up, it is not just the health problem of today, but the people of today are producing children who for the next 30 years will have a health deficit. So India, if you don't consider nutrition and going beyond just MMR and stuff like that, look at the fundamentals of are we having a healthy progeny? Looking at the primal prevention and so on, very important. But Indian healthcare at 2047, what it potentially can be, is a leading contributor to that GDP. As in every developed nation, that would be also generating maximum employment for doctors, for paricharaks, and also for other kinds of administrative staff. Universal healthcare should be a reality in India by that time. A healthy nation from the problems I told you, multi-generational health deficit, we should move to being a healthy nation. And of course, the flagship program of the government of India, which is Heal in India and Heal by India, is, I think, will evolve into something which is a big force for transformation. Heal in India, get the world to come to India, right? And we'll talk about this soon. And Heal by India is to send Indian health professionals to the world, right? And where does Ayurveda play? The diagram on the other side is representing a complex system. Why I bring that up, it's not very easy to just break up Ayurveda and say that look at it unidimensionally and look at projecting what's going to happen in future by taking one or two issues. You need to go beyond that. So This slide is from psychology, Erik Erikson's 8 stages of psychosocial development. Why I bring this up, we are a multi-millennia old tradition. Yet in independent India, we are about 75 years old now. And we still have the problems of an infant. And why I bring this up, if you see this, I think if you see the first 4 stages, right? This cycle typically says that at any stage, if you want a fulfilling life or you want a mature system, you need ego integrity, right? So this actually typically in the 60th year of life, you need ego integrity, you need generativity versus stagnation. Typically in evolution, human beings, systems, everything goes into stagnation, lack of innovation, right? So we should not delude ourselves. We need to understand where we are today and where we need to go with a clear mind. So I want to tell that many of these issues, if we go back and look at any sector, there will be different kinds of problems. It is not that every sector solves every stage before it comes to the last stage. But I want to say Ayurveda needs to take cognizance of this particular thing. When you look at a Vision 2047, in a multi-parametric, multi-system, systems analysis, if you want to go into it, rather than just go and posit one vision that I want to do this and that becomes an outcome. What will be the outcome, the results? I need to take typically a scenario planning exercise. What is likely to happen? What is the probability? What are the different kinds of things that can happen? How do I prepare for each of these probabilities? Some more likely, some less likely, right? So whether I look at, so I'm taking some of the factors here, the first 4 or 5 are very important in looking at how do you approach this Vision 2047. So the focal issue, the first point there, right, for Ayurveda services is to what extent, in which specific areas, how can we make Ayurveda Chikitsa and where will it evolve into in the next 25 years? That's the question from a scenario planning that we should be looking at. And will Ayurveda mainstream? Can it mainstream? Right? We should not go just with just optimism. We need to understand, will it mainstream? And if it mainstreams, what is the nature of that mainstreaming? Therefore, this slide, I'll just take 2 minutes quickly. When you look at the key factors which are affecting healthcare or Ayurveda healthcare, and this is only specific to Ayurveda Chikitsa, is the top line, typically in a scenario planning exercise, you take a brainstorming, collect all the factors from everybody, all the stakeholders, and put down everything that can impact. So I'm bringing here, there is going to be an interplay between domestic versus MVT patient. Am I focusing on Ayurveda as Ayurveda Ahar, Ayurveda Aushadha, or Ayurveda Vihara? Or are we looking at medical care, therapeutic wellness, leisure wellness? Are we looking at preventive, curative, promotive, right? When I say promotive, it is rehabilitation plus health promotion. Are we looking at Roga Shamana, which is there happening in many clinics? Or are we talking about Roga Samprapti Vighatan at a whole person level, which you spoke about? Multiple systemic problems. What is this Ayurveda Chikitsa that we are talking about, right? We all need to come to a clarity and uniformity in that. Are we looking at public health, where the public at large are being impacted, or are we talking about niche Ayurveda, right? So we need to put a mirror. Are we looking at standalone or integrative? What is the proportion of that? So Rogi versus Roga. So this play, this will depend. All of this is going to be impacted, in my view, by this layer below. And I bring up the first important point, the payer system, right? How much do people who fund healthcare will fund Ayurveda? We know that Rajeshi, the ministry has been trying very hard to bring insurance and Ayushman Bharat into the purview, or Ayurveda into the purview of that. Unless this goes all out, unless the money comes into the system, you're not going to have the other wheels of the system grow. So whatever else we might say, modern medicine grew when insurance came, CGHS came, all of that came. If you don't get that engine pushing Ayurveda, you're not going to get that. Access to capital is going to be very important. I'll come to this. HRD, it's a common point, right? The human resource, quality and quantity. I want to bring one part, and thankfully Dr. Painsit did touch upon many of the points that are relevant. My idea is not to go deep into what we need to do here, but just to state the point. If you want Chikitsa, you want services to grow, it will be on a bedrock of well-trained physicians. Now, those well-trained physicians will have to know multiple things, including how to work with their counterparts in modern medicine. Not in competition, but as partners collaboratively, right? the research, and this also involves paricharaks. If you do create only doctors without well-trained therapists, the sector won't grow. Third part is research, clarity on what are the research goals, right? A lot of being talked about research. What are we doing research for? Is it only into some molecules? Is it into chikitsa? Is it into the totality of the public health system that we are creating? What are the health outcomes of the Ayurveda health system? So unless we look at what are the clarity and the unanimity that these are the three areas that we want to do research towards building evidence and put proper investment into it, that Vision 2047 will be stunted. It will be delayed. Then you look at safety record. I think we have to consider Ayurveda and Ayush systems of medicine somewhere along the line. If there is a safety issue which becomes public, it becomes a major issue, particularly when raw material availability becomes an issue and the quality, there is mass production happening. You're going to have also untrained doctors doing. If safety becomes an issue, that can set back the progress of the sector. And ultimately, the medicine part, you need raw material availability, quality raw material, and manufacturing process upgradation to bring in better standardization. All of this on a foundation of three things: an effective regulatory system. I'm a believer for Ayurveda, you need more regulation at this point than less regulation. You need to ensure that good Ayurveda is practiced. We don't just license anybody and everybody to practice Ayurveda. The medicine sector, the Ayurveda Ahar sector, everywhere we need effective regulation based on the principles of Ayurveda. We're talking about a chikitsa mindset. The mindset of chikitsa is that whether I'm giving aushadha or I'm giving ahar vihar, I still think in terms of how do I treat the person as a whole for this place time. That mindset change, till it comes, will break up Ayurveda into only one herb or one this thing or that thing. We have to look at Ayurveda as a complete repository of clinical capabilities. Finally, the identity of brand Ayurveda. Noted. So, brand Ayurveda, what does it mean to different people? So, external factors, our relative ability to influence. I was very glad to hear that when Vaidya Kotecha came back from Finland, the geopolitical, economic, social, at that level, gradually with the GTCM, there is a impact that we are creating now, but this is going to be a challenge. Can we enter the US market? Because regulatory hurdles will be there. So any country that you go into, we have to consider cultural, social, even you talked about Snehapana, the amount of quantity you can give, the cultural factors. So critical uncertainties, I would just want to bring it in the scenario planning exercise. Do we have adequate focus? Not do 100 things. Clarity on what we want to achieve. Excellence in what we do. Not just clap each other on our backs and say we're doing great things. Do excellence, invest into that, and seek synergies between different arms of the Ayurveda sector. This will require commitment, patience, and collaboration. My last slide, Ayurveda, I think second last slide, 4 scenarios. Typically in a scenario planning, Ayurveda will be a vibrant mainstream medical system in India. It may also be in select countries globally. It may become a mainstream medical system globally in 25 years. These are scenarios. There's also a fourth scenario. It does not fulfill its full potential unless we take into account the hard realities. The opportunity for India is to be a global healthcare destination powered by Ayurveda. I say Ayurveda is a Brahmastra for Indian healthcare, if it is used fully. Both standalone and integrative. Ayurveda is a rigorous, professional, accredited, regulated system of medicine, which will lead to a high-value ecosystem where doctors earn more, everybody earns more, and it's a profession with dignity. The final, to summarize everything, define and work towards 3, 5, 7, 10-year goals and milestones. Enable scale that will come through public health and payer engagement. Ayurveda as chikitsa, brand identity, and I just want to bring this part here. Build a win-win alliance with modern medicine. We are not confronting them. We have to work as partners with them. Earn their respect. Not everybody is an enemy. Everybody wants to work, collaborate. They're also patient-centric. One bad apple there does not make all of them bad. We need to work with them. We need to digitalize to leapfrog. And with that, we should also promote entrepreneurship so that doctors set up hospitals. And we have great achievements happening here. And with this, I come to my last slide. Namaste.